Hello everyone, today we'll see how to take a focused history for the clinical exam. So the total marks for this station is 10 marks and the timings total 22 minutes. 22 minutes, 9 plus 4 minutes with the role player and rest 9 minutes with the discussion with the examiner. So before you take the focused history, you need to follow the initial steps, that is which the examiner, which the patient, and of course the patient will not be there, the role player will be there in the station, and which the role player and introduce yourself. That is like, good morning, I'm Dr. Ashia, one of the kids doctor working here. You say like this. Next is you have to confirm the identity of the mother and the child. For example, the mother's name is Emily and the child's name is John. You say, I believe I'm talking to Emily, mother of John. You have to confirm like this. And you have to always introduce with a smile and try to establish a rapport with the mother. Okay. And next you have to clarify the rule. Clarify your rule that just say, today I'm here to ask you a few questions regarding John. Is it the right time for you? Is it okay if I ask you a few questions regarding John? Okay, you have to ask like this. And also you'll be taking some notes, so you have to ask for the same. So is it okay if I take down some notes? So this is how you need to follow the initial steps, that is wish, introduce, confirm the identity of the mother and the child, and clarify your rule that you are here to ask a few questions and also take down some notes. And history, let's see the subheadings under which you will take the history. That is, you have to take the history of present illness, elaborate the symptoms and try to find out the cause in this history of present illness, and the relevant past history. So history of present illness and the past history, and allergy history. Allergy history you can take it separately or within the past history. And next is, remember this BIND, B-I-N-D. Before birth history, I for immunization, and for nutrition and development. Next is family history and history, home environment, social history you have to elaborate, and psychosocial factors affecting, you have to take the history regarding this, social and school and puberty. So history of present illness, past history and allergy history, and birth history, immunization history, nutrition, development, family, home environment, social, school and puberty. Alright. And if the patient is an adolescent, you also have to take the history regarding the mnemonic. You have to remember HGATSS. That is, you have to take the home for sure, education by himself or the family, whether he is alone or lives with the family, and activity, whether he's how is the activity, how is his mood, and sports, any drug intake, any smoking, alcohol. Usually adolescents will be addicted to the smoking and alcohol and the drugs. You have to ask history regarding the same. Home life, education, activity or the sports and drugs. And you have to ask history regarding the sex, that is if the patient is having any boyfriend or the girlfriend. You have to ask in a very empathetic way, and also we have to also ask about the school. Okay, so these headers don't forget in case when you are taking a history from an adolescent. And one more important thing is here, school as well as suicide, any self-harm, school and self-harm history you should never forget taking history of the self-harm. So this is the format for taking the history. We'll go into details. So you need to follow some rules for taking the focused history. That is, always start with an open-ended questions. So what is open-ended questions? We just need to ask, if the mother says my baby John has a headache, you don't ask how is this headache, when did it start, at the beginning itself. So you need to ask the open-ended questions, like you can just ask a question like, can you please describe me his headache? Can you please elaborate the symptoms more for me, please? So you have to be very empathetic, always show empathy to the mother. So because the examiner is watching you, how you take history from the mother. So you have to show empathy to the mother, and begin with an open-ended questions. Don't ask close-ended questions like how did it start, when did it start, and so and so. So it's always better idea to start with the open-ended questions, and mother will elaborate the symptoms when you ask, how can you please describe me more about it. And if, you can ask the close-ended questions to the, if mother has not described, if she has not elaborated, then for that you can ask the closed-ended questions, but always start with an open-ended questions. That is the general rule, so that helps to save the time. Okay, the next rule is never use the medical jargons. Don't use medical jargons. So don't ask, is there any arthralgias? Is there any arthritis? So the mother will not know arthralgias or arthritis. So you can use the joint pains or use the normal language. Don't use the medical jargons, because if you use the medical jargons, you will be given negative markings. And ask one question at a time. One question at a time. Don't ask two questions at once, like is there any headache, is there any joint pains, is there any difficulty. Don't ask 2 or 3 questions at a stretch. Just ask, is there any joint pains? Mother will say yes or no. Is there any headache? Mother will say yes or no. Okay, don't ask 2 or 3 questions at one time. Okay, one question at once. Don't ask 2 or 3 questions at once. And if the mother says she's worried about the child, she's worried about her child, then you need to say, oh, I'm really so sorry to hear, Emily. I'm really so sorry for John. I'm so sad to hear this. So you have to show empathy. And if the mother praises the child, if the mother says good things about the child, you need to praise, oh wow, nice to hear, great, excellent, how lovely boy. Okay, you have to keep nodding your head, and you don't sit like a statue and they keep on writing things. You write, you'll be given a paper, so you write in very short forms, and make an eye contact with the mother, not always seeing your, don't be always engaged in just writing and taking down the notes, but talk to the mother and establish a nice rapport with the mother, and always show empathy and make an eye contact with the mother, and take the history in very short forms. Okay, you need not keep on, you don't make yourself busy just taking notes. Okay, and don't say nice to meet you in an acute emergency setting when the mother is like very worried, and in an emergency setting like the baby is very sick and on ventilator or something. Don't say nice to meet you. It's always better to avoid saying nice to meet you, because of course the baby is sick and you cannot tell, it's not correct to tell nice to meet you. Okay, so these things you need to follow and keep it in mind when you take the focus history from the mother. So let's see into the 8 sections. So always start the history of present illness with an open-ended question. Can you please describe me more? Can you please elaborate a little bit more? So you need to ask the open-ended questions first. Then in the history of present illness, cover the onset, OCD, onset, course and duration, aggravating factors and the relieving factors. Onset, course, duration, aggravating factors, relieving factors. If the mother complains of the pain, then you need to, for the pain, ask about, remember this as mnemonic, severity, onset, the character, radiation. How do you ask for the radiation? Where else does the pain spread? If there is radiating pain, just ask, can you please tell me where else the pain spreads? Association factors, the timing, exacerbating factors and relieving factors, and the severity. So how do you ask the severity of the pain? So you need to say, if I have to ask you to rate the pain on a scale of 1 to 10, 1 being not bothered about it and 10 being worst pain of life, how much marks do you give? So you need to ask on a rating scale like that about when the mother complains about the pain, like headache or joint pains or anything. Next, inquire about the general condition, that is, so is there any fever, any weight loss recently, how is the appetite, how is the sleep, any interrupted sleep, and is there any swellings like that is the lymph node swellings or the neck swellings. Next, inquire about the systemic reviews. So you need to ask relevant questions in the systemic reviews, that is, for the CVS, ask if there is any history of fainting, any exercise intolerance, any exercise intolerance, any blue lips. Always try to avoid the medical jargons here, please. And how to ask about arrhythmias, any heart racing, palpitations. Okay, palpitations, how do you ask? Is there any heart racing or any chest pain? And if there is a case of headache with hypertension, how do you ask about the blood pressures? Has anybody checked blood pressures? Has anyone checked blood pressures before? Blood pressure measured before? Any edema, how do you ask? Any swellings in the legs? Can you place did you notice any swelling in the legs? Swelling in legs. Okay. And for an infant, when is there any sweating on the forehead while feeding? Okay, this is the relevant history when you inquire about the CVS system. So the fainting, exercise intolerance, blue lips, heart racing, chest pain, blood pressure. Anyone measured blood pressure before? Any swellings in the legs or any sweating on the forehead while feeding? Then what do you ask for the respiratory system? Is there any cough, any cold, any difficulty in breathing, any snoring in the night, any snoring during sleep, any sore throat, any history of recurrent chest infections? Don't say chest infections. It's appropriate to say any recurrent chest bugs. So they don't understand what is infection. You can just say any recurrent chest bugs, any chest tightness in case of asthma. And so this is the relevant questions in the respiratory system. And what do you ask in the case of central nervous system? Headache, any weakness anywhere, any weakness in the body, any did you notice any kind of eye deviations, any concern if the child is having a developmental delay? You need to ask any concern regarding vision or hearing, okay. Any concern regarding his speech, any unusual walking? How do you ask for ataxia? In any unusual walking? Is there any history of any unusual walking, any difficulty walking, any abnormal movements in the body? Did you notice any abnormal movements in the body? Any changes in his mood, in encephalitis, any changes in mood, in depression or anxiety? Did you notice any kind of behavioral change recently? Any behavioral change? Did he, in the case of developmental delay, you need to ask, did he lose any skills before? Did he lose any kind of skills which were present before? And do you have any concern regarding his head size? Any concern regarding his head shape? Okay. Any signs of raised ICP, like any vomitings in the early morning, any blurring of the vision? Okay, that you need to ask. An important thing is the neurocutaneous markers you need to ask, that is did you notice any kind of skin spots, meningococcal meningitis, or neurocutaneous markers? Okay. And urinary system you need to ask, the history relevant is gender urinary system. Did you notice any change in pee amount? Don't say urine, just say pee amount or the pee color, or increased frequency of the pee, or pain while peeing. Okay. And what to ask in the case of musculoskeletal system? That is skin spots, any joint pains, any joint swellings, okay. Difficulty in climbing the stairs, taking the stairs, or difficulty in getting up from sitting position, okay. Changes in the hair, changes in the nails, okay. And this is a questions relevant to the musculoskeletal system. For the GIT system, you need to ask about any tummy pain. Don't say stomach pain, just say tummy pain. This looks appropriate. Tummy pain, any increase in the tummy size, any tummy pain, tummy size. Or did you notice any kind of yellowing in the eyes, or throwing up in the morning, or difficulty in swallowing difficulties, or any kind of rash? Next is, and hematology, you need to ask about did you notice he's getting pallor, okay. Any bleeding in the case of ITP, or any recurrent bugs, and for leukemias. And anyone checked his hemoglobin, before. Okay, for endocrinology, relevant is thyroid status. You need to rule out, that is there any sensitivity to the cold, any sensitivity to the hot, and anyone checked the blood glucose before. Okay, and is there any hair loss, is there an increased skin pigmentation in case of Addison's. Okay, and salt craving in case of Addison, and at the end of the histopathological illness, if not asked, just also try to cover any concern about his pee and poo. You need to ask. Okay, pee and poo. Don't say stool, just say pee or poo, urine and the stool, pee and the poo. Okay, any concern regarding his pee and poo. Okay, and if you're suspecting any syndrome, how do you ask in the history? Any unusual features? Does he look like you or daddy? Look like you or daddy, you can ask. So after the history of present illness, you need to take the past history. Remember this 5T plus IOA. So it stands for any history of trauma, any history of any travel, any transfusions before, and treatment history, medication history, any previous medications taken. Okay, and any team involved in child's management, you need to inquire here, and any investigations done so far, what was done so far, any investigations done so far for the child's symptoms, any operations done before, any admissions before, or any history of any allergy to the food, allergy to any medications, you need to inquire. So in the past history, also ask about any similar complaints before, or any underlying medical any similar complaints before, or any underlying medical conditions. Unless until sometimes the patient's mother won't tell, the mother will not reveal unless until you ask. So ask about any underlying medical conditions like underlying cystic fibrosis or underlying kidney disease, or did anyone check his blood pressures? Investigations, did anyone check his blood pressure before? In the case of diabetic, did anyone measure his blood sugars before? Okay, in the case of hypoglycemia, did anyone measure his blood sugars before? That things you can ask. And also anytime drug levels, in known case of seizures, anytime drug levels done for the anti-epileptics, that thing can be asked. Any drug levels done for the medications, you can ask. Okay, this is all about the past history. Next is the birth history. In the birth history, you need to take antenatal and natal history and the postnatal history. In the antenatal history, you need to ask any fever during pregnancy, any rash during pregnancy, any medical condition she has during pregnancy. Okay, any infections or any bugs during pregnancy. And if relevant, you can also ask if she has taken any alcohol or smoking during pregnancy, any substance abuse. Okay, and did she have any concerns in the jelly scan, antenatal scans? So antenatal scans, if you tell, they won't understand, so you can tell like jelly scan, any concern about the jelly scan which is done during the pregnancy. And age of the, if you are suspecting any syndromic baby, age of the mother during conception, age also, if relevant you can ask. And natal history, what was the type of delivery, normal delivery or section? Okay, what was the time of delivery, was he born on time or not, to see the term or the preterm. Okay, and what was the birth weight, and you need to ask about in the natal history. And in the postnatal, ask about, remember this, 3N plus JMC. That is, what was the nutrition? And is for nutrition, what type of the feeding was given, whether breastfed or formula. Okay, and next is newborn screening. Any newborn heel prick test done? Don't ask about newborn screening. You can ask about heel prick test done. Heel prick test. That is the newborn screening, heel prick test. Any hearing screen done or not? And any NICU admissions. Just ask about any admission to the baby care unit. Okay. And any jaundice, was there any lowering of the eyes for the skin, and when was the baby passed the meconium? Especially it's very important when you're dealing with the case of constipation. When was the first meconium passed? Okay, and when was the baby discharged from hospital? Okay, you need to ask. And any home oxygen required in case of chronic lung disease, any home oxygen if required after discharge. Home oxygen if relevant, you need to ask. And if it is a case of preterm, you need to elaborate a little more about stormy neonatal course, what happened and all that. You need to inquire in the case of preterm or the prolonged NICU stay. Next is BI, that is immunization history. Ask if jabs were taken on time. Did she miss any jabs? You can ask. BI. And the nutrition. Ask how is he feeding, how is his appetite, and who prepares a baby's food. Okay, who prepares, any concerns about any concern regarding his weight, and any concern regarding his height. So you need to ask about the weight and height and the nutrition, who prepares it, and does he drink fluid appropriately or not in the nutritional history. Okay, next is development. You can ask if the infant, you can take the detailed developmental history, or in the case of developmental delay or the CNS, you can take the developmental history in detail, or else you can just ask, is there any concern regarding his development? You can ask about it. Okay. Next is the family history. In the family history, you can just again ask the open-ended question here. Can you please describe me your family? And inquire the consanguinity. Are you and your partner related? Always call the partner. Are you or your partner related? You and your partner related, to ask about the consanguinity. Okay. Any similar condition in the family. Very important thing to ask is any similar illness in the family, any similar complaints in the family. Okay. Any chronic disease in the family. Suppose any case of asthma or cystic fibrosis, any chronic genetic conditions, or you can ask any you need to inquire about the chronic disease, or you can ask Any medical conditions in the chronic medical conditions. Okay. And inquire about the chronic disease or the medical conditions in the family, especially when you are dealing with the cardiac case. Any history of any sudden deaths in the family. Very important to us. Sudden deaths in the family, especially HOCM. Okay, they will have sudden deaths, arrhythmias, long QTs. They will have sudden deaths. You need to inquire about any sudden deaths, especially epilepsy or case also. Any sudden deaths in the family. Any significant event at home. If baby is anxious and she's having chest pain or something like that, you need to inquire about any significant event at home. Any stress at home. Okay. And if the and you need to draw the pedigree chart. If the mother is having 2 or 3 siblings, suppose this is the patient admitted, you're admitting, you're dealing with the patient this, and you need to ask who looks after your other children. If you are with this baby, who looks after the other sibling, you need to ask. And also you need to ask about the occupation of the mother and the father. What do you do for the living? What do you do for the living? Okay. What is your partner's job, or what is the father's job? You need to inquire about the job. Any financial issues at home, any financial crises at home. Very important to ask. And how does here in the UK they stress a lot on the psychosocial factors affecting the child and the family, so you have to inquire about the condition. How is this medical condition affecting the family? How does this medical condition, especially if recurrent admissions is happening, you need to ask about how is this condition affecting the family. So you need to inquire about the home environment, old home or the new home. Ask about the old pipes or the new pipes, old pipes or not, or any old paintings for the lead poisoning. Any modifications done at home, any modifications done at home. And how is the ventilation at home? How is the ventilation at home in case of asthma? Furniture, any old furniture at home, asthma again for. And how is the floor? Any carpets at home? How do you clean your home, like the vacuum or not in case of asthma? Anyone smoke at home? Are there any nearby factories? Okay. Any social support they are receiving? Any emergency healthcare plan? Ask about the emergency healthcare plan they have received in case of anaphylaxis, emergency healthcare plan, or cystic fibrosis exacerbation. Okay. Emergency healthcare plan. Any educational healthcare plan did they receive? Any financial support they are receiving? Any social support they are receiving? You need to ask. And in case of asthma exacerbation, does the child go anywhere else to sleep over night, like the grandma's home? That you need to inquire in detail. Next is social history. Ask about the attitude with the friends, with the teachers. Is he aware of his condition? Is he aware of his condition or not? How is he dealing with it? How is he coping with this condition, especially chronic condition? How is he coping with it or dealing with it? And you need to inquire any social support that they are receiving, and attitude with the teachers, attitude with his friends. How is his behavior at home and behavior at school? You need to inquire the social history. And in the school, you need to inquire the type of the school the child is going. Ask about the type, that is going to the mainstream school or the special school. And in case of chronic condition, the school teachers, are they aware of his condition? School teachers like diabetes mellitus, type 1 diabetes, are the school teachers aware? Allergies, okay, anaphylaxis, are the school teachers aware of his condition? You need to inquire. And recent change in the school, any missed school days because of his illness. Did he miss any school? Any missed school days? You need to inquire. How is his attendance at school? How is his performance at school? Does he like going to school? Okay. Any bullying issues at school? Very important to ask. Any bullying issues at school? any educational healthcare plan he is receiving, educational healthcare plan you need to inquire, and any upcoming exams. Any upcoming exams in case of anxiety, stress, hypertension, any upcoming exam stress you need to inquire, any upcoming exams, any stress at school, and that's all about and in case of constipation, how is the toilets at school? Are they clean or not? You need to inquire, because if the toilets are not clean, the child will fall and will end up in constipation. So you need to inquire about the toilet hygiene at school. And inquire about the pubertal concerns if the child is an adolescent, if the adolescent or the teenager. Any concerns about the puberty, you need to inquire. Any pubertal delays or the precocious puberty concerns, if they are relevant, you need to ask about it. And if in case of adolescent, you need to inquire about, that's already discussed, the home, education, activity in the sports, drugs or the smoking, alcohol he's taking, and how is about his sexual life, having boyfriend or girlfriend, using OCPs, or any self-harm, any thoughts of any self-harm, you need to inquire. So these completes the format for history taking. So after taking the detailed history, you need to summarize the history to the examiner in 4 to 5 lines. Summarize the main important points, main points and the positive points, main and positive points in maximum 4 to 5 sentences. So yeah, you need to, after taking the focus history, you need to thank the mother or the role player. You need to thank for giving the history. So that's all about the session today. So remember the general rules. Always begin with an open-ended question, and always show empathy. Be always empathetic. Listen to the mother very carefully, very patiently, and avoid the medical jargons, and avoid asking 2 or 3 questions at one stretch. And don't always sit like a statue, and always smile to the mother and praise the child if mother says the good things about the child, and always introduce yourself and establish a rapport with a smile. And resist temptations. You resist your temptation to interrupt when she's talking, and don't keep yourself busy taking the notes. Make always an eye contact with the mother. Okay, and write your notes very briefly, and summarize your history in few sentences, maximum of 4 to 5 sentences, very briefly. Always tell about the main positive findings, and don't forget the important negative history to include in the summary, and give your most likely diagnosis and 4 to 5 differential diagnosis with the clinical reasoning. Why this is not, why are you thinking about this, why not that. So always try to give the justification or the clinical reasoning for your differential diagnosis, and yes, and discuss the management plan with the examiner. Okay, yeah, that's all today, and thank you so much, and take care.